leaving dozens of travellers to find a new home. The decision was voluntary, but comes after growing anger from neighbours over rooftop parties at a time when social distancing measures are being tightened.
And it made it almost impossible for us to run as a business.
Ferried into taxis, backpackers with nowhere to go were offered 2 free nights in a city hotel. After that, they're on their own.
People are facing not being able to get home. They're out of work with no money.
Jim Wolf is one of them.
I booked a flight 2 weeks ago that got cancelled, so I decided to book another flight, and that's also cancelled.
The government has blamed backpackers for a cluster of COVID-19 cases in Bondi.
It's really targeted the backpacker community, which has led to people going to work and being told, oh, sorry, don't come back, and they've been fired.
And some hostels are now rejecting any traveller who's previously stayed in Bondi. This pop-up clinic was primarily set up to test backpackers for coronavirus, but so far there have been very few people through its doors. Many seem more concerned about trying to get a flight home. But with some one-way tickets priced at up to $24,000, getting home is almost impossible.
There's nobody really to blame in this situation other than judging backpackers for being unprepared for an uncomparable situation.
And the police commissioner says he isn't prepared for this to go on indefinitely.
It is 90 days and I certainly won't be seeking an extension.
Until then, expect more police cars than people.
It's a very long time, especially in the winter when people get into depression because of the darkness.
A sign that no longer applies. Mark Reddy, ABC News, Sydney.
Thousands of nurses will be trained to work in intensive care units to meet the steep increase in demand. It comes as plans are put in place to construct makeshift hospitals across the country. Medical reporter Sophie Scott has more.
Registered nurse Dexter Cornelius knows the pressures of an intensive care unit, which is why he's volunteering to help.
I do feel like it's a call to arms. I feel like I want to be there for the people that are in need, that are sick, that are requiring the ICU admissions, but I also want to be there for my colleagues.
He's one of 20,000 nurses who'll be offered free training so they can be upskilled to care for the sickest of patients. Australia has more than 250,000 nurses.
They are by far the largest workforce in the health system, but we need more. We're leaving no stone unturned to make sure that we can have as many nurses as we can, ready and able to meet the demand that we're anticipating.
Authorities are also encouraging thousands of former doctors, nurses, midwives and pharmacists whose registration has lapsed to return to the medical front line.
We've had tremendous volunteer support. Medical staff, allied health staff, nursing staff, doctors. What I am seeing is the best of Australia at the worst of times.
It's part of a bigger plan to boost Australia's readiness for a spike in COVID-19 patients. Just like this field hospital in New York's Central Park, preparations are underway for makeshift hospitals across Australia, including a purpose-built facility in Canberra. Sites like Brisbane's RNA Showgrounds, the Melbourne Convention Centre and Sydney's Olympic Park could be turned into makeshift medical facilities.
But to ensure those hospitals are never needed, health experts have one simple message.
We just encourage everyone to stay at home, to flatten the curve and to reduce the burden on our healthcare system.
The new training for nurses will start in the coming weeks. Sophie Scott, ABC News.
Australian scientists have reached a critical milestone in the search for a possible vaccine. The preclinical trials are being conducted at the CSIRO's High Containment Biosecurity Facility in Victoria. They're working on 2 potential options with help from scientists in the US and the UK. This stage of testing is on animals, with ferrets being injected with the vaccine candidates. Ferrets were also used in the creation of a SARS vaccine because they have a similar reception on their lung cells to humans. Now that the ferrets have been given the vaccine candidates, they'll be exposed to coronavirus in about 3 weeks. Scientists will then monitor it to see if they're able to shed the virus.
What we've been able to do since January to now normally takes a year or so. So to give you an idea of the haste and speed we're working on, Joe, this is the enormity of the task we face.
Even with the acceleration of this phase, Australian scientists say we're at least 12 months away from a vaccine, but they say it's a promising development in a global scramble to defeat the pandemic. Overseas now, the UK has recorded its worst day since the pandemic began, with 563 deaths and more than 4,000 new cases. Worldwide, the number of confirmed infections is approaching 940,000. According to data from Johns Hopkins University, nearly 200,000 of these patients have recovered. But it's the pace of that recovery and treatment that's coming under increasing scrutiny in the UK, with one British surgeon labelling his government's response as shoddy from the beginning. Europe correspondent Samantha Hawley reports.
Health workers line up for a COVID-19 test. With the pandemic worsening, the ones who are cleared can get back to work in hospitals where they're desperately needed. But Britain's failing to meet its target for testing. The need emphasised by the Prime Minister from isolation in Downing Street.
And I want to say a special word about testing because it is so important. And as I've said for weeks and weeks, this is the way through.
Surgeon Mark Gallagher has seen the problem from both sides. After testing positive, he took his self-isolation seriously.
So I've stuffed this gap with a T-shirt. The gap around the side of the door is much smaller. I have sealed that gap by folding up pieces of paper like this.
Now recovered, he's unimpressed with the way the pandemic has been handled.
The response we've seen in several European countries, and I think particularly the UK and the Netherlands and Sweden, is shoddy, amateur, and just not proportionate to the extent of the problem.
Prince Charles has also sent a message from isolation. He says he's come through the illness, but being cut off from family and friends is distressing.
Let us try and live with hope and with faith in ourselves and each other, look forward to better times to come.
The UK will have to get through the pandemic without one of its great summer traditions. The All England Tennis Club has cancelled the championships at Wimbledon for the first time since the Second World War. Samantha Hawley, ABC News, London.
A dire White House prediction of at least 100,000 coronavirus deaths has jolted the United States, prompting more states to issue stay-at-home orders and sending markets further into the red. Emergency room doctors at the centre of the crisis in New York have made a desperate plea for the nation to wake up and get ready for a rapid rise in cases. North America correspondent Catherine Diss reports from Washington.
Face mask manufacture on an industrial scale. General Motors has joined America's fight against COVID-19, recalling wartime efforts for a nation now bracing for a viral onslaught. New York doctors at the coalface of the crisis, painting a grim picture of what's to come.
We're running out of medications, we're running out of equipment, and we're even running out of oxygen, which is something that patients that have COVID-19 need.
And you can think of it as your lungs being filled with fluid, like you're drowning.
This is not something that's isolated to the old. Please hear this warning and do whatever necessary to prevent this from spreading.
Under the latest White House modelling, between 100 and 240,000 Americans could die from coronavirus. The stark numbers have jolted states still questioning the danger into action. More than 300,000 people across 37 states and the capital now under some form of lockdown. After resisting for weeks, Florida, America's third largest state, today issued a stay-at-home order for its 21 million residents and cast doubt it would let 2 cruise ships carrying more than 130 Australians dock in its waters.
My concern is simply that we have worked so hard to make sure we have adequate hospital space in the event of a COVID-19 surge that we wouldn't want those valuable beds to be taken. because of the cruise ship.
In poorer southern and midwestern states, the virus has silently surfaced. There are now hotspots in some of America's poorest cities, Louisiana and Michigan among the states facing a rapid spread. As the numbers sank in, Wall Street tumbled, fearing the global downturn could be far more punishing and long-lasting than initially thought. Catherine Diss, ABC News, Washington.
To other news, 2 men are tonight